Don't dismiss memory loss in older adults. 10 underlying causes and a comprehensive evaluation process. As we age, health concerns often grow. One of the constant worries for both older adults and their families is memory loss and other cognitive issues. Many people mistakenly believe this is an inevitable part of aging, something unavoidable and not worth worrying too much about. However, this belief is entirely incorrect and can lead to unfortunate consequences. Similarly, the idea that there are no effective interventions for memory decline acts as a significant barrier, preventing individuals from accessing the necessary support and treatment. In reality, memory loss and cognitive problems in older adults are not always simply signs of old age. Sometimes they can be symptoms of an underlying medical condition, a side effect of medication, or a treatable health issue. Overlooking these signs not only delays diagnosis and intervention, but can also cause the condition to worsen, severely impacting the patient's quality of life and placing a heavy burden on their family. The video highlighted a crucial truth. There are many different causes that can lead to memory loss and cognitive decline in older adults. Accurately identifying the cause is the first and most vital step in developing an appropriate treatment and management plan. We will explore the 10 most common causes and simultaneously learn about the comprehensive evaluation process that doctors should follow to help older adults and their families get the right answers and direction. Understanding these points will help us change our perceptions, act promptly, and bring hope to those facing challenges with memory and cognition. 10 memory thieves. Common causes of cognitive decline in older adults. Memory loss and cognitive decline in older adults can stem from a variety of sources. Accurately identifying the cause requires a thorough evaluation by medical professionals. Here are 10 common groups of causes that we need to pay special attention to. Medication side effects. This is an often overlooked but quite common cause. Older adults frequently take multiple medications to manage chronic conditions. Some drugs or interactions between them can cause side effects that affect brain function, leading to confusion, difficulty concentrating, and memory impairment. Medications commonly associated with these issues include sedatives, sleeping pills, antihistamines, opioid pain relievers, some cardiovascular drugs, and Parkinson's disease medications. Reviewing and adjusting medication dosages or replacing them with alternatives can significantly improve cognitive status. Metabolic imbalances. Our bodies are complex systems, and the balance of electrolytes, as well as liver and kidney function, plays a crucial role in the activity of all organs, including the brain. Electrolyte disturbances, such as abnormal sodium, potassium, or calcium levels, and impaired liver or kidney function, can cause symptoms of confusion, disorientation, and memory loss. Treating these underlying health issues can often restore cognitive function. Hormonal issues, especially thyroid hormones. Hormones act as chemical messengers, coordinating many vital functions in the body. Hormonal imbalances, particularly those involving thyroid hormones, hyperthyroidism or hypothyroidism, can affect brain function. Hypothyroidism, where the thyroid gland is underactive, can cause fatigue, mental sluggishness, and memory impairment. Conversely, hyperthyroidism can also lead to anxiety, restlessness, and difficulty concentrating. Thyroid function tests are an important part of the cognitive decline evaluation process. Vitamin deficiencies, especially vitamin B12. Vitamins are essential for many biochemical processes in the body, including brain function. Deficiencies in certain vitamins, especially vitamin B12, can cause neurological and psychiatric problems, including memory loss, confusion, and even numbness or tingling in the extremities. Vitamin B12 is typically found in animal products, so vegetarians or those with absorption issues are at higher risk of deficiency. Blood tests can identify vitamin deficiencies, and timely supplementation can improve symptoms. Delirium. Delirium is an acute cognitive disturbance that typically occurs suddenly and tends to fluctuate throughout the day. Symptoms include confusion, disorientation, reduced ability to focus, and sometimes hallucinations. Delirium is often caused by an acute underlying medical condition, e.g., infection, surgery, dehydration, medication side effects, or substance withdrawal. Treating the underlying cause of delirium is crucial for restoring cognitive function. Psychiatric illnesses. e.g., depression, anxiety. Mental health is closely linked to cognitive function. Psychiatric illnesses, such as depression and anxiety, can manifest with symptoms that resemble memory loss, such as difficulty concentrating, forgetfulness, and feeling mentally foggy. Treating mental health disorders with psychotherapy and/or medication can significantly improve cognitive abilities. Substance abuse or withdrawal. Excessive use of substances like alcohol or drugs can cause long-term brain damage, leading to memory loss and other cognitive problems. Similarly, the process of withdrawing from these substances can also cause temporary confusion and cognitive decline. Brain cell damage. Due to injury, direct damage to the brain, such as from a stroke, small vessel disease in the brain, causing microstrokes, or head trauma from an accident, can cause permanent damage to brain cells, leading to impaired cognitive function, including memory, language, and executive function. The degree and type of impairment depend on the location and severity of the damage. Neurodegenerative diseases, e.g., Alzheimer's, Parkinson's, Lewy body, frontotemporal degeneration. This is a group of progressive diseases characterized by the gradual degeneration of nerve cells in the brain. Alzheimer's disease is the most common cause of dementia in older adults, affecting memory, thinking, and behavior. Other neurodegenerative diseases such as Parkinson's disease, Lewy body disease, and frontotemporal degeneration can also cause specific cognitive, motor, and behavioral issues. Accurate diagnosis of the specific disease type is crucial for appropriate management and treatment planning. Infections. Certain infections, especially those affecting the brain, e.g., meningitis, encephalitis, or severe systemic infections, e.g., sepsis, can cause confusion and cognitive impairment. Prompt treatment of the infection can help improve or restore cognitive function. Toxins, e.g., heavy metals, pollution. Long-term exposure to certain toxins like heavy metals, lead, mercury, or environmental pollutants can cause brain damage and contribute to cognitive decline. Recognizing the diversity of causes for memory loss and cognitive decline in older adults is the first important step. It underscores that not every case of memory loss is a sign of Alzheimer's disease, and many cases may have treatable causes. This highlights the importance of comprehensive medical examination and evaluation when any concerning signs appear. Indispensable initial evaluation steps, a guide for doctors assessing cognitive decline in older adults. When an older adult presents with suspected symptoms of memory loss or cognitive decline, performing a thorough initial evaluation is critically important. This process not only helps determine if there is indeed a cognitive issue, but also aims to pinpoint the underlying cause. The video suggested 10 essential steps that doctors should take during the first assessment. Ask and document the patient's concerns about their cognitive function and memory. The first and most crucial step is to listen directly to what the patient feels and worries about regarding their ability to remember, think, and perform daily tasks. Document these complaints in detail, including the onset, severity, and frequency. This gives the doctor an initial overview of the problems the patient is experiencing. Gather information from others, e.g., family members, about signs of memory loss or cognitive decline. The patient themselves may sometimes not recognize or fully remember changes in their cognition and behavior. Information from relatives, friends, or caregivers plays an incredibly important role. They can provide observations about issues the patient might overlook, such as missing appointments, repeating questions, difficulty managing finances, or changes in personality and behavior. Ask about difficulties in managing daily activities. Functional assessment. Cognitive decline often affects the ability to perform activities of daily living, ADLs, and instrumental activities of daily living, IADLs. The doctor needs to ask about the difficulties the patient experiences in activities such as dressing themselves, eating, personal hygiene, medication management, cooking, shopping, using transportation, and managing finances. The degree of difficulty in these activities can indicate the severity of cognitive impairment. Assess other signs of behavioral, mood, or cognitive symptoms. Besides memory loss, other cognitive issues such as language difficulties, speaking or understanding, reduced ability to focus, visuospatial dysfunction, or changes in behavior and mood, e.g., becoming irritable, anxious, apathetic, losing interest in favorite activities, also need to be noted. These symptoms can suggest specific causes of cognitive decline. Ask about any new symptoms or changes in physical health. Cognitive decline can be related to other physical health issues. The doctor needs to ask about any new symptoms or recent changes in overall health, such as fever, headache, vision changes, dizziness, limb weakness, or digestive problems. This information can help detect potential underlying medical causes of cognitive impairment. Thoroughly review all medications, especially those affecting brain function. As mentioned, medication side effects are a common cause of cognitive decline. The doctor needs to review a list of all medications the patient is taking, including prescription drugs, over-the-counter medications, and supplements. Pay special attention to drugs with known side effects that impact brain function. Adjusting dosages or changing medications can lead to significant improvement. Perform a comprehensive physical exam, including a basic neurological assessment and gait evaluation. A comprehensive physical exam helps the doctor assess the patient's overall health and detect signs of underlying medical conditions. A basic neurological assessment includes checking functions such as reflexes, muscle strength, sensation, balance, and motor coordination. Gait evaluation can detect abnormalities related to neurological conditions like Parkinson's. Conduct in-office assessments targeting memory and cognitive abilities, e.g., orientation assessment, mini-cog. Simple cognitive screening tools can be performed right in the clinic to provide an initial assessment of various aspects of cognitive function, such as short-term memory, concentration, language, and executive function. Tests like orientation assessment, asking about date, month, year, location, or mini-cog, recalling and repeating 3 words drawing a clock, can help detect early signs of cognitive decline. Order laboratory tests and evaluate the necessity of brain imaging. Based on information gathered from the patient's history, physical exam, and cognitive screening tests. The doctor may order blood and urine tests to check for underlying medical causes, such as electrolyte imbalances, liver and kidney function, thyroid hormones, and vitamin B12 levels. In some cases, brain imaging like CT or MRI scans may be ordered to detect structural brain damage such as stroke, tumors, or brain atrophy. Summarize and document patient and family concerns, difficulties with daily living, and objective cognitive assessment results, as well as the plan for evaluating potential medical causes. The final but incredibly important step is to summarize all the collected information, including the concerns of the patient and family, daily living difficulties, cognitive test results, and the subsequent plan to investigate potential medical causes. Detailed documentation helps track progress, share information with other specialists, if needed, and develop an appropriate management plan. The video emphasizes that this initial evaluation can and should be performed in primary care settings by general practitioners or family doctors. There's no need to wait for access to specialized memory clinics to begin the assessment process. Early and comprehensive examination will help detect causes promptly, implement appropriate interventions, and improve the quality of life for older adults and their families. Don't hesitate to seek medical help if you or a loved one have concerns about memory and cognition. Early action can make a big difference.